Hello guys, welcome and welcome to Metier International Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and Flex and OET training. And today we are going to discuss an important topic in Magic Pill session. And all the topics, whatever we are discussing, it is already asked in previous year question paper. Based on that, only we are discussing these topics. So let's begin the session without wasting the time. So today the topic is going to be from Nursing Foundation, and the main subtopic is bed sore, and all the questions whatever they have asked in the previous year examination related to bed sore we are going to discuss today. The first question is, the patient has been in coma for 2 months. The nurse understands that to prevent the effect of shearing force, the head of the bed should be at the angle of. So this is the question. As usual, you need to find out the key point here. So here the key point is the patient is in bedridden, that is coma for 2 months. That is the first key point. And second one is to prevent the shearing force. Usually the shearing force is a frictional force. It will cause what? Bed sore. Okay. So the friction will happen in the skin and breakdown of skin will happen. So that is called as what? Shearing force. In order to prevent the shearing force, which angle we need to give in the bed? Okay. So head end of the bed, some angle we need to provide. So what is the angle? That is the question. So here you can see 4 options, that is 30 degree, 45 degree, 60 degree and 90 degree. And among this, the right answer is option A, that is 30 degree is the right answer. So why we need to give 30 degree? First, you should know what is shearing force. I have given the meaning also. It is a sliding movement of the skin. When we are sitting in a fowler's position, the body will go down. For example, we are sitting in a cot, okay, and watching a movie. For example, I am telling. So slowly we are sliding down, right? So what will happen? You know, the skin is going to get friction. So once the friction is continuously happening, for example, in this question, they have mentioned that the patient is in coma for 2 months. Okay. So if you are giving a fowler's position or any position which is causing sliding and shearing force is happening, friction is happening, means easily breakdown of skin will take place and there is a chance for bed sore. So in order to avoid the bed sore, what angle of head and elevation we need to provide to the patient? So here the right answer is what? Option A, that is 30 degree, or else they can also give in the options like Trendelenburg position. Trendelenburg position also the angle is maintained only 30 degree in the head side. Okay. So here you can see in this image, this is the not Trendelenburg, that is recommend position. Okay, what position? Recommend position. So in recommend position, you can see here the head end is elevated to only 30 degree. Okay, I am not going to give a semi-fowler's position or high fowler's position. This will increase the problem. The shearing force will increase. Instead, I can go with the recommend position. Here you can see the recommend position. Okay, so which position will avoid shearing force for a long period of time? The recommend position, that is 30 degree elevation in the head end is always recommended to prevent the shearing force. Okay, so here the answer is what? Option A, that is 30 degree. So the next question is, what is the frictional force exerted by the fluid also called? So here in this question, 2 key points are there. Frictional force exerted by the fluids. Okay, so this question asked in the ESI examination. So this question I am going to explain you with an example. Okay, so they have given 4 options like core, slag, effort and drag. What example I am going to give now? See, they have mentioned frictional force in the fluid. I am going to give an example of a person who is doing swimming in the swimming pool. While the patient is diving, what is happening? You know, the person is moving forward and the water is resisting against him, moving against him in the opposite direction, right? So this is called as what? Frictional force, which is created by the fluid. And the term, medical term which is used here is drag, D-R-A-G. So here in this question, the right answer is option D, that is drag. Okay, so the definition I have given here, the frictional force exerted by the fluid is called as what? Drag force. It is nothing but a resistance force caused by the motion of the body through a fluid like water. Okay, fine. The next question is, which condition is assessed using Braden scale? It is very common question. So many times this question asked in the examination. So Braden scale means immediately what should come into your mind? Let's see the option. Burns injury, muscle strength, bed sore, anxiety level. So here the right answer is what? Option C, that is bed sore. Braden scale means bed sore should come into your mind. Okay. See, when you are thinking or talking about bed sore, few things you have to keep in mind. So few important vital points has to be kept in mind. In Braden scale, 1, 2, 3, 4, 5, 6. 6 factors are there. What are all they? Here you can see sensory perception, moisture, activity, mobility, nutrition, friction and tear. So like this, how many factors are there? 6 factors are there. Okay. And the total score in the Braden scale is 23. Please remember that 23. Okay, so based upon the score, we can categorize the person into mild risk for developing bed sore, moderate risk for developing bed sore, like that, till very high risk. There is a classification. We are going to discuss that also. Okay, first, what you should know is Braden scale means it is used for bed sore. And what are all the factors present here? 6 factors just now I discussed, like sensory perception, moisture, activity, mobility, nutrition, and frictional and shear. Okay, and let's discuss the scoring because that is very important. From there also there is a chance for asking the question. Okay, here you can see the scorings. So this is the interpretation score of Braden scale. As I mentioned already, the Braden scale ranges from 6 to 23. The minimum score is 6 and maximum score is 23. Please remember that. Okay, the next one is we are categorizing the bed sore patient. There is a chance for developing bed sore. Okay, so this we are going to categorize into 4 categories, that is mild risk. The score given for mild risk is 15 to 18. These points are very, very important. Please make a note of it. Okay, the mild risk means the score is 15 to 18. Moderate risk means 13 to 14. High risk means 10 to 12. And very high risk means 9 or less. Okay, so this thing has to be memorized. Okay, fine. So the next question is, in which of the following stages of pressure ulcer nurse will observe there is a partial thickness loss of the dermis? This is the key point. Partial thickness loss of the dermis. In which stage this will happen? Okay, fine. Let's see the options. First stage, second stage, third stage, fourth stage. And here the right answer is option B. That is second stage. In second stage, there will be a partial thickness loss of the dermis with open ulcer. Wound without slough. Slough means a covering like eschar. Eschar tissue means thick black color tissue. Means usually the eschar tissues will be formed because of ischemia, lack of blood supply. A hard, thickened eschar tissues will be formed. Usually by surgical debridement only we can remove that eschar tissues. Otherwise, it is not possible to remove the thick tissues. Okay, fine. So here, as per the question, partial thickness loss of the dermis with open ulcer, wound without slough is commonly seen in the second degree bed sore. So here in this side, I have classified the stages. There is stage 1, stage 2, stage 3, stage 4. Let's discuss the key points. In stage 1, non-blanching erythema. Here you can see just redness will be present. Okay, with intact dermis. There is no changes in the dermis. You can see here only redness, no changes in the dermis. That's all. This is stage 1. Stage 2 means partial thickness ulcer. This is related to the question involving epidermis and dermis. Here you can see epidermis and dermis, 2 layers are involved in stage 2. It is called as what? Partial thickness ulcer. The third one is stage 3. Here dermis as well as subcutaneous tissue is also involved. So the bed sore is extended up to where? Subcutaneous tissues. But the muscle bone is not involved in stage 3. Only it is extended up to the subcutaneous tissue. The last one is stage 4. Here the bed sore, it is extended till muscles as well as bones. Okay, see here you can see very clearly the depth of the bed sore. Understand, guys? So these are all the classification of what? Pressure ulcer. Okay. The next last question is to properly stage a pressure ulcer, and they have given 4 options. What are all they? Eschar must be removed. The skin must be properly removed. The natural light must be used and patient must be in supine. So which is the right answer here? Here you can see eschar must be removed. To see properly the pressure ulcer, the eschar tissues has to be removed. Usually the eschar tissue, it is commonly seen in the 4th stage or beyond 4th stage. Okay, so in this stage, what will happen? The eschar tissues will be present. In order to find out what stage the patient is suffering from, we need to remove the eschar tissue and then only we can find out what stage the patient is suffering from. That is, what stage the bed sore is present for the patient. Okay, so this question also asked in JIPMER examination. Okay, guys. So hope everyone understood what is bed sore, what scale is used, what is the scoring, and what are the factors present in the burden scale and stages of bed sore. Each and everything we have completed in this slide. If you have any doubt anywhere, drop your message in the chat box, and all the best for your upcoming examination. If you like the videos, please like it, share it, and subscribe the channel. Okay, so it will be acting as a motivation for us. Thank you very much, guys.